Imagine wearing gloves indoors in the middle of summer, just so the air conditioner doesn't trigger an episode and turn my fingers blue. Or wearing a jacket when everyone else is in shorts.
Debbie Smith is 32, a communications manager for a trade association and fitness enthusiast. She has a busy, active lifestyle. But when Debbie gets cold, the pain can be excruciating.
My fingers turn white and then blue within minutes of being exposed to the cold, and then red when they start to warm up. It's really painful. It started in my teens, and all this time I just thought it was poor circulation, but finally I decided I should see a doctor about it.
Debbie suffers from a condition called Raynauds phenomenon, a disorder of the small blood vessels of the extremities, which reduces blood flow. Dr. Hal Mitnick is a clinical professor of medicine and rheumatologist in the Division of Rheumatology at NYU Medical Center. He has spent years working with patients like Debbie who suffer from Raynauds phenomenon.
After cold exposure or emotional distress, patients with Raynauds may experience spasm of blood vessels. This most commonly affects the fingers and the toes, but sometimes the ears and nose as well. The consequence is a lack of blood flow to the fingers, and white and then blue color changes occur, and upon rewarming, there is redness. The patients experience tingling, numbness, and sometimes pain during these episodes.
According to the Raynauds Association, 5 to 10% of Americans have Raynauds, and 90% of them are women. Simple tasks like holding a cold drink or placing hands in the freezer to grab food can be all it takes to trigger a response. Even in warm weather, air conditioning may cause a painful spasm.
Noticing your hands are turning blue.
Initially, many sufferers might write this off. In fact, 80% have no idea their severe response to cold actually has a medical explanation.
I try to avoid getting cold, but sometimes I just can't. I've tested more types of gloves, mittens, and warm clothing than I ever thought imaginable. I stick my hands under my armpits no matter how ridiculous I look. I want people to understand I may look miserable or unapproachable, but I'm not. I'm just cold.
What I'm going to do is examine your hands and fingers now to see whether there are any changes suggestive of primary or secondary Raynauds.
There are two types of Raynauds, primary and secondary. The most common type, primary, isn't linked to another medical condition or disease, whereas secondary Raynauds is. For patients like Debbie who have primary Raynauds, the condition isn't disabling but can cause great discomfort and pain. Avoiding the triggers whenever possible is key to managing the condition. Patients with the secondary form are more likely to suffer serious problems like skin ulcers or permanent blood vessel damage, which is why it's so important to see a doctor. A blood test known as ANA, or anti-nuclear antibody test, can be conducted to determine the type of Raynauds a patient has.
Raynauds phenomenon may occur at the time of or years before the onset of an underlying connective tissue disease or other medical condition. Awareness of such a problem may allow for earlier medical intervention.
While there is no cure for Raynauds phenomenon at this time, you can work with your doctor on treatments to control the severity and frequency of episodes. The Raynauds Association is a great resource for useful tips, warm product reviews, as well as advice from medical experts and Raynauds sufferers just like you. For a copy of their comprehensive guide, including answers to frequently asked questions and treatment options, visit raynaudsguide.org. This message is brought to you by the Raynauds Association with the support of Apricus Biosciences.